Hi, my name's Rebecca Brown. I'm an MD, PhD, and NF and Schwannomatosis expert. I'm here to record a video for you about my support for the iHealth and Wellness Foundation. I'm really proud to be involved with this foundation because, like myself, its mission and its values align in that I truly believe that people should be empowered to understand their own health, to make informed decisions about it, to share their thoughts and feelings with the community. And this holds true not only for neurofibromatosis or NF, but also Schwannomatosis, SWN, and other complex diseases. It's really about empowering people to make a difference in their own lives and in the lives of others who share in their experiences. And I stand 100% behind that. I wanted to also talk to you a little bit about what is NF and what is Schwannomatosis. And some of you may be asking and scratching your head saying, well, why aren't I talking about NF2? So let me update you a little bit. NF1, NF2, and Schwannomatosis are all conditions caused by different genetic alterations, all of which predispose people to grow tumors along the nerves, in the skin, along the spine, sometimes in the skull, but they're all what we call nerve tumor predisposition syndromes. And as I mentioned, they're all caused by different genetic causes. So for example, NF1 is caused by a mutation in chromosome 17 that is completely in a different location than the mutation that's found to be associated with Schwannomatosis, including NF2. Doctors used to think that Schwannomatosis and NF2 were completely separate entities. They thought that there were some clinical differences between the people who had Schwannomatosis and NF2, and also that there were genetic differences. And for the most part, that was correct. But we now understand as a medical community that NF2 forms one part of more of an umbrella group of disorders called Schwannomatosis. NF2 is caused by a mutation in chromosome 22, which causes tumors to grow in both hearing nerves, whereas in Schwannomatosis, the tumors may grow in one hearing nerve on one side of the head, but not necessarily on the other side. Both conditions can predispose people to the growth of tumors along the peripheral nerves and can lead to symptoms such as pain and visible lumps or bumps throughout the body, sometimes weakness and numbness. NF1 also causes the growth of tumors within the body, but these tumors may be more visible. So there are small nerves that are grown within our skin. And if a tumor happens to grow upon one of those nerves, it makes a skin bump, which in medicine we call a cutaneous neurofibroma. These can be very visible on top of the skin. They can lurk just beneath the skin. Or if they involve one of the larger nerves that's located deep down in an arm, a leg, or inside the thorax or the trunk, it can grow into a larger tumor known as a plexiform neurofibroma. All of these types of tumors are associated with NF1, but not with Schwannomatosis, usually. People with NF1 may also have coloration on their skin, birthmarks, which we call café au lait macules or COMs. And they may also have freckles on the colored parts of their eyes. These freckles don't affect vision. For different reasons, we recommend that people with NF1 see an ophthalmologist at least once a year, but the freckles on the colored parts of the eye do not have any effect on your health. So in essence, that represents the big difference between NF1 and Schwannomatosis, including what is now called NF2 related Schwannomatosis, or simply NF2 Schwannomatosis. I also wanted to talk about mental health, because a big part of my support for iHealth is addressing a previously unaddressed issue, which is that dealing with these sorts of conditions, including the physical appearance of skin bumps in NF1, the chronic pain in NF1 and schwannomatosis, and potential vision or hearing loss in NF1 and schwannomatosis, that can add a lot of anxiety to somebody's life. And indeed, we find that in people with NF1 and schwannomatosis, there is a much higher risk of those people having depression and anxiety, also learning disabilities such as ADHD. And for this reason, I feel that having a secure community that provides real answers and real information about how, when, and where to seek care is crucial. A lot of patients ask me how much of who I am is related to this gene mutation, and who would I have been if I wasn't born with a mutation in NF1? And I have a pretty scientific answer to that question because I'm a pretty scientific doctor. All of us are born with different genes. There is no one human genome that is the right, appropriate, or normal human genome. Every person's DNA is slightly different in many, many different ways, like a fingerprint. So I have mutations in many of my genes. You have mutations in many of your genes. Not all of those mutations lead to a disorder such as NF1, NF2, or schwannomatosis, but they all affect who we are as individuals. And those genes are no different. So when I am asked, who would I have been without NF or schwannomatosis? Would I have had the personality I have? Would I have had the life that I have? Would I have had the job that I have? The answer is, of course not. Because your genes form who you are from a very early age, and you would be a completely different human being if you didn't have that particular mutation. And personally, I am very thankful for all of you and for all that you contribute to the world. Other thing that people ask me about with NF1 and schwannomatosis is a risk of cancer. For NF1, the skin bumps associated with NF1 and the café au lait macules will never develop into a cancer. If they are truly the cutaneous neurofibroma or CALM, those do not become cancer. The risk of cancer in the skin of people with NF1 is missing something that can affect anybody who's been out in the sun, including basal cell carcinomas, squamous cell carcinomas, and melanomas. There are larger tumors, the plexiform tumors, that can be hidden down in the body that can turn into a cancer. And that really is the reason why you want to follow with an NF clinic or a doctor who's specialized in NF, because you deserve the recommended surveillance imaging by an expert to try to catch any changes that happen in these tumors and take care of it before it becomes an issue. So what I'm saying in essence is you should let us bear the burden of that surveillance so that you can go about your normal lives. With schwannomatosis, there's a much lower risk of cancer. There are some treatments, such as radiation, that are sometimes absolutely necessary, but radiation can also very slightly increase your risk of cancer in those conditions. It's not exactly the same as in NF1, where there is an inherent risk of cancer in the plexiform tumors. So I'm going to stop here, and I really appreciate your listening in. I cannot tell you, overjoyed to be serving as an advisor for the iHealth and Wellness Foundation. And I hope that everybody is having an amazing day and will reach out to their friends and family and share some love and find yourself a good NF doctor. All right, thank you very much.